Hi, and welcome to the Healthcare CEO Show, where you'll find actionable insights on healthcare leadership from the best and brightest in the industry. I'm your host, Daniel Fernandez. Let's get a pulse. We're going to be talking to Ryan Iwamoto. He's a co-founder and president of 24-Hour Home Care. We're going to be covering a few topics today, one of which is the meteoric rise they've had from startup to one of INC's fastest growing organizations in the US, and some of the partnerships he's developed over the years that have been really stellar. We'll talk a little bit more about that. And then some of the self-branding thought leadership that he's been doing over the years as well. So welcome to the show, Ryan.
Hey guys. Hey Daniel, Jody, nice to be on the show.
So in 13 years, Ryan, you've gone from startup to a company that employs over 10,000 caregivers, serves 10,000 clients across 3 states, and generates over $120 million annually in revenue.
In 13 years.
In 13 years, 13 short years. That is an incredible feat. Let's talk a little bit about the beginning. In 2008, you started the company during a recession, not exactly the ideal time. I think we would all agree.
Yeah.
But yet you managed to carve out a niche for yourself. I mean, what was the initial thinking process? And well, one, I'm in sort of this recession, and two, how do you even find this niche? Like, what is the reasoning behind even starting it?
Yeah. Well, no, it's a very great question. I'll start with this. Actually, a lot of great companies have been started in a recession. So if you think about it, in 2008, I believe like Uber started, Airbnb was around the same time. So you see a lot of these companies finding the opportunity in some of the challenges that the time is presenting for businesses. So we were like one of those companies, obviously not at the size of Uber and Airbnb, but hopefully one day. But yeah, in 2008, it was an interesting time for me, just to kind of get you to the genesis of starting 24-Hour Home Care. Prior to that, I actually worked with a large nationwide healthcare company. So I was in the recruiting piece of it. And, they were mainly focused on the skilled side of home care. So what they call home health. And when I started, they just launched their non-medical home care, which is what 24-Hour Home Care does today. So I learned a lot about the industry. I learned that every single day, 10,000 baby boomers turn 65 till, I think it's like 2030. And most people want to live at home. People are living longer. So it made sense from the opportunity side. And then around the same time, I was faced with finding care for my own grandmother. And I was in the industry, and it was a challenge, and no one teaches you it. No, it's not a conversation you have with your friends or family for the most part, but every single person is going to face that challenge, whether you're providing the care or you have to find the care. So I knew that opportunity was there, and I felt it. So I felt like I had both that professional lens of the opportunity and also the personal lens of the challenge. And I was able to kind of mirror that together to really give a lens for 24-Hour Home Care and the opportunity 24-Hour had in the industry. And then when I look back, 12, 13 years ago, home care was very fragmented. There was really only 2 types of home care companies. So you have on one side, you had the mom and pops or the franchises that were like mom and pops, but they had a franchise name. And then on the other side of the spectrum, you had your large home health companies, like the company I used to work with, and then they did home care as a side or secondary service, but usually wasn't their focus. And there was nothing in between. So you have, again, mom and pops, and you have these large behemoth home health companies, nothing in between. And we really felt like there was an opportunity for an organization to really be or take the professionalism of a nationwide company and combine it with the personalization of a mom and pop. And that's where 24-Hour Home Care came about.
Now, you're still relatively young. I consider myself young as well. How old were you when you started the company?
I was 26 years old.
26 years old.
Yeah.
And do you think were there advantages and disadvantages to being a 26-year-old leader in the healthcare space?
Well, first, Daniel, now everyone knows how old I am. So thank you for that. But I will answer your question. I think there was both. There was advantages and there's disadvantages. I think the advantage of being 26, starting a business is one, you don't really have any experience of starting a business. You don't know better. So you have, I guess you can say, that blind ambition to just go forward and fail as many times as you can and learn from it. And you have less experience to hold you back and say, hey, maybe you should do this because of XYZ that you experienced before. So I think we'd really leverage that when starting the company. And then, so I think it gave you an opportunity to take a little bit more risks. Also, at 26, I was living with my parents. So I had that opportunity of, they still charged me rent, but it was very small. Yeah, that's smart on their part. But yeah, I was living at my parents' house. I saved up some money from working at my previous company and, an opportunity to take some risks. And I think it allowed me to partner with my co-founders at the time, and we launched 24 Home Care. I think the downside is your youth, right? You don't have the experience going out, especially in healthcare, where you have, in our industry, home care, typically you're dealing with a little bit older people, more seasoned people. And there's plenty of times, whether meeting with a family or meeting with people at the hospitals for referrals, they would look at me and say, wait, how old are you again? And I would say, oh, late 20s, try to kind of buffer it a little bit. But yeah, I think there's always some concern, but you own it with courage. And I think once you start going over, what the value that we can bring to them, then quickly, I think that got washed away. Now, 12, 13 years after, for better or worse, I don't have to deal with that concern anymore because people never question how young I am anymore. So, but yeah, it definitely has its perks. It definitely has its disadvantages, but you want to focus on your perks.
Yeah, I mean, definitely I would see that as a strong advantage as well, because you're not doing things the way they've always been done. So it gives the ability to kind of think in a different way.
Yeah.
Definitely would have been a competitive advantage. Since you didn't have decades and decades of experience, were there other organizations and brands that you were able to sort of draw some concepts from and maybe apply those to your own organizations?
Yeah, definitely. I'm going to come back to that question. I just want to add one more thing as a disadvantage. This is more of an ego disadvantage, but I was 26. We hired our first employee at 27, and I was still living at home. So think about it, owner of a company, running this home care company. And then I would, okay, guys, I'm ready to head home. Mom has some meals that I have to, that mom's cooking dinner tonight. So I got to be back by a certain time. Yeah, not best for the ego. So you got to kind of get over that hump of, yeah, I'm still living with my parents and I'm the owner of the company. But yeah, besides that, we're able to make it work. But yeah, just to answer your question on companies that I guess you can say I really looked up to, and the co-founders, I really wanted to model ourselves. It goes back to, you have the small mom and pops, and you have the large nationwide companies. So we thought about what's a company that we can emulate that did something that was like in between. And that company outside of our industry, there's one that came to mind, and that's Trader Joe's. So Trader Joe's did an awesome job to really find that niche, right? They're not a mom and pop. They're not your large grocery supermarket. They found a way to really capture both, right? They're your neighborhood grocery store. I believe that's still their tagline. But man, they're everywhere now. But you always have your Trader Joe's. It's like, oh, that's my Trader Joe's. They felt like it's really part of your local community. And we really wanted to capture that. And in addition to that, Trader Joe's is defined by, they have competitive pricing on their goods. They have quality goods. So for us as a service, to provide quality service, and then the people that you deal with or work with at a Trader Joe's, they just seem more invested in what they do. They take more ownership in what they know and what they do. They're positive. They usually have a smile on their face. They're wearing the Hawaiian shirts. It's just a little bit more fun, right? And you compare that with the mom and pops and the large grocery stores chains, you don't really see that. So again, we felt that we can take that same concept of being, okay, we're not going to be your cheapest. We're not going to be your most expensive. We're going to be right there in the middle and provide a quality service. But the people that you deal with at 24 Hour Home Care is just going to be a little bit more engaged, a little bit more passionate, a little bit more motivated than probably your local mom and pop. And that's where we really positioned ourselves. And we actually, I don't want to say steal, but we are inspired by Trader Joe's. So their tagline was your neighborhood grocery store. So for the first like 6 or 7 years, our tagline was your community home care provider. So you guys heard it first here, had some
Brilliant.
inspiration from Trader Joe's, but yeah, that was our tagline for, probably the first 5 or 6 years of the business.
That's great. Yeah, it kind of reminds me of when you say we didn't steal it, it kind of reminds me of the whole like coming to America thing, like McDonald's and McDowell's.
Yeah.
Like it really made it your own. And I think that's the beauty of it all.
I just watched that. Yeah,
Did
but to
you?
go outside of the industry, that I don't know if that comes with youth or just an expanded mind, but you're not stealing. You're borrowing. Like business is business. You know, the basics. So to appreciate the culture and the processes and the corporate ethos and to emulate that, I think that's magnificent. That's really exciting. Taking some notes here.
Yeah, and just to add to that, I think that is, not to toot my own horn, but I think if there's one trait that I felt like I've had for, even when I was a kid, is just the ability to like see something and connect the dot to see how it can make it work for, in this case, 24-hour home care. I'll give you another example. So, and I know we're going to talk about some of the partnerships down the road too, but just one example that comes to mind. I remember watching the NFL in the month of October, and then I started seeing the NFL doing certain things in the month of October. And I don't know if you guys know what they do.
The pink stuff.
The pink. So celebrating breast cancer awareness, they started wearing the pink gloves,
Pink shoes,
the pink shoes, the pink towels, and it really created this whole sense of visibility for breast cancer awareness. And I was like, that's perfect for us. And if you see any of our sales teams, back in the day, our field staff, they would wear these blue polos, like kind of a baby blue polo and khakis. And they still do that today. Although it's not baby blue, it's more of like a royal blue now. But I said, and people knew us for that, for the baby blue all the time. You'll see baby blue and khakis, that's 24. In October, we had the idea of being inspired from the NFL, but let's change those baby blue to pink polos. And now everyone used to seeing us in baby blue would wear pink, and we would create some campaign around it, whether it's donating or giveaways, and really promoting breast cancer awareness. So we have this whole breast cancer awareness month. Everyone comes in pink, and it's just this like huge shock of like, whoa, you got all these people now wearing pink, and it created a splash. And I think we started doing that in 2010, and we still do this to this day. Pink polos.
Love it.
Yeah. But so innovation, people have may said, okay, wow, you guys are very innovative. And that might be the right word, but it's not necessarily reinventing the wheel. It's more finding things that other people are doing and using that to make it fit for your company or your business or your personal brand.
And I think that's one of the things that we've been discussing, internally as well, that you just sort of can draw from different aspects in different industries. You see a problem, and I think it's a little bit different in how your brain processes a problem than even myself. My first thought is, how do we solve this problem internally? You think, how can I draw on all of the world's resources and expertise to solve this problem? And because of that, you have created some of these incredible, partnerships.
Yeah. And I'll give one more example if we have time.
Yes, please.
And this would only be for the YouTube viewers because you can only see this visually. So, we needed to create our new shirt. So we have this whole thing around our why, which is impacting people's lives by making a difference every day. And then we have these difference makers that we nominate every month. So we wanted to really enforce that by having swag that people can get behind. So I have this difference maker t-shirt, but the inspiration of this, the design, came from Peloton. So I'm a Peloton user. I picked it up during the pandemic, and you can see all the coaches on there, and they always wear the Peloton swag. And one of the trainers had a shirt very similar to this, had that like gradient design. And I was looking at it, I'm like, that would be awesome for a 24-hour home care shirt. Let's get that going. So I sent it over to our director of marketing. And I mean, again, I don't want to feel like we're plagiarizing, but the design is very similar, same sort of design gradient, but it works and people like wearing the shirt. And you probably can find something similar on Peloton if you wanted to. But again, it's finding something that you think that can work or is finding something that you like, and then how can that come to your company and putting your own twist to it?
That's exactly it. And to your Peloton thing, I took up the NordiTrack, and NordiTrack kind of stole the idea of the live coaching from Peloton.
Yeah.
You know, so Peloton was the first one to kind of do that, and it just kind of caught on at the NordiTrack side of things. And that's just a brilliant way of thinking, just sort of beyond your own, I hate saying box, but it's kind of that idea.
Yeah.
Industry expectations, maybe.
Yeah. And just to add to that, I think people can get, maybe that are not natural innovators. I think people can get really stuck at like, oh, I don't know, like, how do I create this thing, to invent this thing? And it's really, at least for me, it's less about inventing, but it's just being observant to what's around you and seeing if that's something that can work for you and putting your twist on it. That's a whole lot easier than trying to invent something from scratch. Like only a few select people can actually do that. So that's a tip of being innovative without actually not having to be very innovative at all.
Yeah, that's a brilliant takeaway for everybody.
Being observant, let's say.
Observant, yes.
Exactly.
Mm-hmm.
I had a mentor of mine that said, you don't necessarily want to be the first one to do it, but you can do it better, and just focus on that. Yeah.
There's many companies that weren't the first that did it, but now they're known for that product. And one example is the Oreo cookie. Oreo is not the originator of the Oreo cookie. The company that started it, you can Google this, was called Hydrox. Sound like a cleaning company.
I remember those. Yes.
Google Hydrox, and it's the Oreo cookie, but somehow Oreo got that idea, and literally it's the same thing. They put it together, and now everyone knows the Hydrox as Oreo. But yeah.
Wow. Yeah, we need more of you in the home care space, or you just run the home care space, because I just love that. It just makes it fun.
Leading the pack. Yep.
Different. 100% leading the pack. Going back to creating some of these partnerships and how you see a problem and then sort of craft the solution. And in 2015, you created the Ride with 24 program. Tell us a little bit about that.
Yeah, so this goes hand in hand with what we were just talking about of spotting an opportunity that you can bring to your own company. So obviously everyone knows Uber, but this came about actually from one of our offices where we started seeing employees using or leveraging Uber for our caregivers. And I remember spotting this because we would look at the P&L and we would see all these expenses for Uber coming in, right? And like, that was a kind of a red flag. Like, why are we spending, X amount of dollars on Uber charges? Like, what are we doing? Are we paying for people, like employees, to like go back and forth? Like, that was not approved. But we looked into it, right? We looked into it, and we found that one office was using Uber to get caregivers from one shift to another, or from their home to a client's house. Especially if their car broke down, or maybe they didn't drive, and the only way they would take the assignment would be, if they were able to get transportation. So I was like, that's brilliant. That's awesome. Let's do this. And we started doing that across the company, which is great. Then we started thinking about, well, why can't we do this for the clients as well? Because one of the number one requests for a senior that we work with is transportation. And we also found out, so it's like 80% of them, they want to check the box of having a caregiver that can drive. 80% of our clients. But I would say only about 10 to 20% of our caregivers actually can drive or are comfortable driving our clients. So that's disproportionate amount of supply and demand there. And it would always be a pinch point of finding a caregiver that can drive for the majority of our clients. So we would have to scramble, or we may not find the right actual fit for the caregiver, personality fit or skill set fit, because of the transportation barrier. So then we started leveraging Uber and say, hey, can we start using them to do the transportation? So the caregiver can go in the ride with them, and then, could be a companion while they get transportation. So we started doing that. And then we took it to, hey, can we bring this to the hospitals? Because the hospitals, they're our number one referral source for, our business. So they provide referrals for people that need care. And then if you've ever worked at a hospital or been discharged from a hospital, they have this whole taxi voucher system. So if they're going to pay for transportation for you to go home, what happens is they give you this like voucher that you give to a taxi, and that pays for the ride. But what happens is that, just like why we probably don't take taxis anymore, most of us, the experience is not good, right? You can't track it, so there's no accountability. And they're always, the feedback from the hospitals also is that they are always asking the patient for tips. So even though that they're giving the voucher, they're like haggling them for tips. And that was a problem. And also it could take, 30 minutes to an hour to get a taxi to the hospital. So we said, hey, can we leverage this to bring Uber into the hospitals? And, the same people that are ordering the rides for Uber for their patients are also the same ones that are referring out home care clients. So these are the same people that we're already dealing with that we can provide a value add. So, and around the same time, so this also was very fortuitous because Uber just launched their Uber for Business platform. And we were one of the first beta companies to use that platform. So basically what that did is it allowed us, instead of having to go and use the app on our phone, we can go on a desktop or laptop and open up the browser, and we'll have this like concierge platform, and we can book multiple rides. So really become a dispatcher.
Wow.
And they only had like 5 or 6 companies at the time in the world. And we were the only home care company. So one of the things we were very proud to say is that we were the first home care company in the world to partner with Uber on this program. And then to date now, we have probably over 100 organizations that contract with us to facilitate their on-demand rides, and then probably around 40 plus hospitals, health systems that contract with us to manage their on-demand rides. So, some of the big name ones is UCLA Health, Cedars-Sinai, Mayo Clinic, Scripps.
Oh my gosh.
So we were able to really get them on board because it's the same, like we're saving them money, 30%. We're faster than a taxi, better experience, and we know exactly where they're going. We can track the ride. So it only made sense for us to do that. And yeah, it worked out. It worked out really well.
Wow. And speaking to the hospitals, you created some sort of partnership with Cedars-Sinai called Care Extenders.
Yes. So this is something that I'm super, super excited about, super passionate about. And I see where home care is going. And I think COVID is really putting an additional spotlight on transitioning care to the home, right? You hear a lot about SNF at home, hospital at home. And I think this was really a great milestone for the healthcare industry to look at this as how do you leverage home care? So what it was a conversation with Cedars-Sinai and their medical group. And they were saying, for their high-risk patients, they had an ambulatory care management team that would go out and do visits. So they would drive to the patient's house and check in on them. They would call them. They would sometimes do tuck-in visits to make sure that they're set up for success. That's hard to do. And you're paying a registered nurse to travel all around to do all these visits. And it's very hard to scale it, and it's very costly. So we were having conversations with them to say, can you leverage our caregivers to be your eyes, ears, feet, hands, and extend the bandwidth of your ambulatory care? So instead of hiring more of these nurses that are expensive to do these visits, let's leverage the caregivers that are going to be a much lower cost that can be your eyes and ears. And if there's more of a clinical need or escalation, then our caregivers can ping the nurses that are, in home base to, take clinical action if needed. So yeah, we did it. We did a pilot. I think there was about 40 patients, frequent flyers that we would look at. We'd go out there. They had anywhere from like maybe a few hours of care for a few weeks to, full-time care. And it was very successful. It was successful where we started tracking the number of readmissions, the patients that potentially could be readmitted. So we call those patient saves. So we had over 50 patient saves throughout that quarter period of time for the pilot, 50 patient saves. And the cost of one admission for one of those patients in the Cedars-Sinai medical group, one of them being admitted, was the cost of the entire program to pay for the caregivers. And we had 50 examples of us saving that patient from being admitted. So you talk about, I can't share the actual cost amount. You can Google care extenders and 24-hour home care, and you can find an article on it, but it was significant savings. And then also we found out some of the more anecdotal saves, which are pretty amazing. And this is something you're not going to see in a data sheet. So couple saves. One of them was we had a care extender that went out, one of our caregivers for a frequent flyer who got constantly readmitted, went out there. The first day, they saw the patient sitting down in the couch, smoking a cigarette with an oxygen machine right next to him, currently blowing oxygen out. And obviously that could have been a horrendous situation, but obviously we were able to step in and fix it. And yes, that counted as one patient save, but the magnitude of what that save was, I mean, they saved the life, they saved the house, they saved maybe the whole neighborhood. But those were some of the stories that we were hearing on the saves that may not necessarily get captured even in the data set. So that was really, really exciting to see of how home care can make an impact. And the beauty of it is that that pilot, the care extenders pilot, went from a pilot and got blessed to turn into a full-on program for the Cedars-Sinai medical group. And then now we're even working with more departments and even the hospital specifically, where we have what we call a STAR program that's kind of focused on getting patients back from hospital to home safely, especially in this COVID environment. So it's led to more programs put together, which is, again, showing the value of home care and showing where we think healthcare is going down the road, which is lower costs in the home.
That is so brilliant for many reasons. Obviously, one is the cost reduction.
Yeah.
Of course, our leaders that are listening will appreciate that. But two is that there's it's no secret there's a national shortage of nurses. So in leveraging, your home care caregivers, that's allows you to kind of better focus the energies of where your nurses are, internally and within your own hospital organization, instead of kind of, like you said, sending them out there on the road.
And it's the way of how healthcare has always been, right? If you think about it, you have your physician, highest cost, right? And then, but you have a physician assistant that can do a lot of the roles at a lower cost, but still be efficient and give more bandwidth to the actual doctor. You have, I'm getting PT right now. Side note, I tore my Achilles. I think I talked to you guys this before in January of 2020. So now I'm doing PT. But in PT, I work with my physical therapist and he sees me for, 10, 15 minutes, does the whole treatment. But then when I'm doing my exercises, I have the assistant that works with me individually, right? So that's a division of labor as well, right? You have the PT that's very expensive, but then you are effectively using an assistant to help with some of the things that the PT doesn't need to really spend time on, like making sure I'm doing every single rep for my heel raises, right? You can use someone else to do that. And I see the same thing happening with in-home care. Yes, we're not going to replace a nurse. You're not going to replace some of the things we're doing in the home, but are there things that a caregiver can be doing, like checking in on, okay, is a patient smoking a cigarette while, having oxygen in the room? Are the patients have food in the refrigerator? Are there, are they stocked with their medication, or do they need to do a run and get the medication? Do they have the supplies that they need? You don't need a nurse for that. You can leverage a caregiver. And some of those things are super important to making sure people are set up for success in the home. So again, it makes a lot of sense. It's way healthcare has been going since really day one. And I'm very, very, very confident that that's where it's going in the next 5, maybe even less years.
Daniel, this confirms the conversation we were having just earlier today about trends. I mean, talking to Dr. Edmondo Robinson, and he works at Moffitt Cancer Center, they had to do a lot of pivots to figure out how to treat the cancer patients during COVID. And there were things that they found that they could do. There really isn't a specialty that this can't pertain to down the line.
No.
PT. Yeah, that's amazing. Wow.
There's so many people that can be helped. Like you said, you've got your PT, but then you also have the PTA, right?
Yep.
Which is
and even on the PT side too. So some of the things that we do is the caregiver, obviously they're not a physical therapist, but what happens is the physical therapist, before they send the patient home, they have them do certain exercises, right? And then when they go home, you're not going to have the physical therapist there. You might not even have an aide there because it might not be scalable to do that with all the patients that are being discharged. But with a caregiver, they may already have the caregiver hired and ready to go. You can train our caregivers to make sure they're doing their exercises. Again, that doesn't take a physical therapist nor an aide to make sure, okay, you're doing, 10 reps here that we need you to do, 10 arm circles. Let's make sure we're doing it. Because I mean, we all know with exercising, you have the NordicTrack and I have the Peloton bike, Jody too.
Peloton.
It's about actually doing the exercise is the hardest part, right? And our caregivers can help facilitate that. And again, you don't need an aide or PT, but yeah, we're not going to replace the PT. I just want to make sure I'm clear with that. Not going to replace it because you still need the person to prescribe it and make sure they're doing it correctly. But our staff can definitely make sure they're doing it and make sure they're following the instructions of the PT.
Yeah. And holding them accountable, because if there's no one around to watch them do exercises, they may not do the exercises.
Yeah. We can all use a coach in our lives.
Amen.
That's exactly right. Amen to that. You've talked about, I mean, this is a very good topic as well, because COVID has been so challenging, but I think in this that you've found some opportunities as well during this whole COVID thing. You've got something called Grub with 24.
Yeah, so we have Grub with 24, and I think this is more of a, I don't know if you want to call it an example or a case study of just really being agile as a company, right? So we're a larger organization, but when COVID-19 hit, we really had to shift gears from our brand and messaging. We basically went from we are your everything convenient home care company, we make your lives easier, to safety and relieving anxiety that you might have around COVID or safety. And we did that literally overnight, and not with a, large marketing team either. With very small, we're building it out, but we had to do that very quickly during this time because no one cared about some of the things we were doing before, but everyone cared about, hey, are you doing this stuff safely? Our employees cared about, hey, do we have the tools to be safe? Do we have the training to be safe? So again, we had to shift gears there, and we created our Safer at Home program, which focused on training, focused on messaging, focused on protocols, just to make sure that our clients, our caregivers, and our employees in the offices were safe, and that everyone knew if you reached out to us, we had everything listed out so you knew what we were doing to make things safe. And it's not much different than when you see with most companies, right? You're going to see a little that you should see just like a blurb on, what are some of the things they're doing with COVID-19. And we did that, and we shifted it pretty quickly. But then also, what are some things that can come out of the challenges? And this kind of goes back to the recession time, right? The recession, there was a lot of challenges, but where are some of the opportunities to rise above it? And one of the things that we saw was our Grub with 24 opportunity. So I think it was leveraging some of the things we're doing with Uber and Lyft. We also work with Lyft now with Grub with 24. But with Grub with 24, we knew that seniors were being socially isolated in their homes, right? Obviously, I think no surprise there. And we knew there's a stat with about 5.3 million seniors were food insecure at the time, meaning they didn't have access to nutritious food, and or they potentially can go hungry every night. And that's just not a picture that you want to paint in your mind. And we thought, hey, how can we help here? Because a lot of these seniors are our clients, and they might not have a caregiver anymore too, because they don't want to, have anyone new in their home. So I think leveraging the whole relationship we have with Uber was, hey, can we partner with a delivery app? And a lot of those were growing at the time too. And we had a conversation with some other ones, but we really found Grubhub to be a great partner. And they worked with us to create something where, similar to what we're doing with Uber and Lyft, is that we have access to their platform where seniors can call us and speak to a live person, and we can put in their order and have that food delivered to them at no cost. And actually, I don't know if this still applies, so don't hold me to this, but Grubhub gave us a discount on top of it So, and we don't charge anything above it. It's just something that we thought we needed to do and be a resource for our community. So it actually, you can get it at a cheaper cost than Grub if you went directly with the app, if you went with us. So it was a service that we felt that was needed for our community. And we did it, and we executed, and we've seen great success with it.
I think one of the most impressive things about you is that any one of these things, these partnerships, these campaigns that you've developed, initiatives, would be impressive in their own way. But you've kind of rolled this out over, I mean, you have 10,000 caregivers.
Yeah.
That to me is one of the most impressive things. When you talk about rolling things out very quickly, I mean, I don't think people get the gravity of it. You're rolling it out over 10,000 caregivers, I mean, across multiple states. It's very, very impressive.
Well, one thing I learned just in terms of as we grew and scale, this term or this phrase that I like to use is progress over perfection. Sometimes people get in their own minds of not even starting something because they're out thinking themselves of all the reasons not to do something, or all the risks that come with that initiative or change. But for me, it's just, hey, what are some of these small steps that I can take? Evaluate it. Is it the right decision? Maybe it's not. Okay, let's learn from it. And then we continue to maybe move in a different direction, or maybe it's the right thing. You continue to move on, but don't get that in the way. Don't get perfection in the way of progress, because you're always going to be outthinking yourself. And especially as someone in like a CEO, president, head of a company role, there's almost like this natural instinct of like, I need to be right, and I need to be making the right decisions at every path. For me, I just need to be comfortable of acting, right? Making sure I don't need all the information, but just give me some information. We can move forward and assess. Because even if it's a failure and you're learning from it, it's not a failure. So in my mind, it's a win-win either way.
My mentor used to put that as get stuff done, then get stuff done better.
Yeah.
And sort of thing. Do it, then figure out how to do it better.
Exactly it. And
Let me go in.
Again, just going back to the way your mind works, I'm just completely fascinated. So of course I have to ask this question. Where do you think it's all headed? Like if Ryan were to pull out his crystal ball today and say, okay, well, where's home care headed? I mean, it would be wrong of me to not ask this question.
Yeah. Well, I think there's a lot of exciting tailwinds within our industry. And I sort of highlighted some of that with the Care Extenders program. I feel like there's going to be a shift to the home, and that is going to be great for home care in our industry. I think COVID again has put another spotlight on that, of the value that we can bring at a much lower cost than your traditional healthcare workforce. So that's really exciting. And we're seeing a lot of policy changes that are supporting that. You Google sniff at home and you're going to see all these different articles of value-based care going to the home. You see a lot of these partnerships with large home health companies working with home care companies of how can we capture this relationship so that we can position ourselves well once, you're seeing more of these patients come to home. Medicare. So home care was never a benefit of Medicare, right? It was always looked upon as a private pay service. But over the last couple of years, we're seeing more focus on home care being a benefit. So I'll give you an example. In 2019, Medicare announced for their Medicare Advantage plans that you can write home care as a supplemental benefit in your Medicare Advantage plan. So that was a huge win, because that was the first time Medicare really said, hey, if you can make it work in your plan and make the costs work, go ahead and put it in the Medicare Advantage plan. So in California, there was 2 organizations that started writing home care into their Medicare Advantage plan. That was Scan Health Plan and CareMore, which is now part of Anthem. And we were one of the first to contract with those 2 organizations. And it was really cool because we were in the room with the product design team who said, hey, how do we make this work? Right. And so we're in the kind of the boardroom, not boardroom, but like the whiteboard room where we were planning it and how we can really make this fundamentally work and not have to really increase too much of their costs. So they created a benefit for respite care. So if you are and this is not even for the actual member, this is for the member's caregiver. If you needed time off you can use that benefit for the member to say, hey, we'll get a respite caregiver from a company like 24 Home Care, and your Medicare Advantage plan is going to pay for it. And we also created a a transition home benefit. So if you're getting discharged from the hospital and you need a caregiver to help you transition home, you get X amount of hours to use a company like 24 to help you there. And for our industry, that's a huge win, because when we're talking to our folks at the hospital, the number one question is, oh, how do you pay for it? And we would always get back to, oh, okay, well, it's a private pay service. It's going to be something out of pocket. But now we go into and say, hey, do you have any Anthem or SCAN members? Because we can find ways to pay for it through their insurance. And that really hasn't been a response ever, unless they have like long-term care insurance. But it's really cool to see that. And then 2 states made some big changes. One in Washington, I think in 2019, they voted to create a long-term fund, a state fund, that would tax employees at a very small percentage that would fund this fund. And this fund will allow people over the age of, I believe it's 65, to get $26,000 to pay for your long-term care costs, whether it's home care or assisted living. And then in the state of Hawaii, a few years ago back, they passed what's called the Kapuna Act. And the Kapuna Act was, they are going to allow, if you are a full-time employee, but also a caregiver of a family member, they are going to give you $300 to help compensate you for that piece of being a family caregiver. So again, these are great steps in the right direction to for our industry, and really for the people that we serve, right? Instead of having to pay out of pocket for it, can we start leveraging some of these benefits? Because in the long run, this is going to help save on the bigger costs of going back to the hospital or getting treatment for different things that could have been prevented by maybe having someone that were your eyes and ears before you got admitted to the hospital. So yeah, I'm very bullish on some of the things that are happening within our industry.
Thank you for joining us on the Healthcare CEO Show. If you've enjoyed this episode, don't forget to subscribe on your favorite podcast platform for more insights from the top. Until next time, lead boldly and care deeply. See you on the next episode.